The particular stimulus we enacted, okay, was almost all spending, very little on tax cuts. The few tax cuts it contained, okay, were not designed to improve incentives, to give people added incentive to work, save, invest. Okay, much of the spending was explicitly sort of bad for incentives, if not, even if perhaps compassionate. Obvious example is very much extended unemployment insurance benefits. Okay? Extending unemployment insurance may be the compassionate thing to do, but it's clearly going to keep the unemployment rate high. It's clearly going to keep the economy at a relatively low level of activity, not encourage sort of economic growth. So from this perspective, the one I just described, tax cuts make a lot of sense, extra spending doesn't. Okay? The Democrats got it almost entirely wrong. Okay? So why? Okay? Is it that the economists in the administration think my view is completely wacky? Okay, I don't know. I haven't asked them. Okay, but I don't think so. And lots of economists, okay, are certainly sympathetic to the views that I've enunciated. I think the reason is that the spending that was undertaken by the stimulus all rewards Democratic interest groups. Okay? Increased spending on green energy rewards the environmental lobby. Increased transfers to states allows them to avoid laying off public sector employees and teachers, okay, two incredibly important Democratic interest groups. Okay? Increased spending on infrastructure, on roads and so forth, okay, rewards construction unions and sends a bright signal to unions more generally. Okay? So the administration tilted its economic stimulus unbelievably, incredibly heavily toward paying off its Democratic base, not toward economic efficiency. And it would have been trivial to have designed a stimulus that was consistent with the evidence and the principles that I've outlined. It would have meant cutting corporate income tax rates, cutting personal income tax rates, cutting employment taxes. Okay? Those things would have all gotten very sympathetic hearings from economists. Okay? They're changes that make sense whether or not there's a recession. They're all consistent with the Keynesian model as well. Those things would all work even in a strictly Keynesian perspective. All those things were actually likely to work much faster than the extra spending. You don't need any time to enact and announce a tax cut. And the people who are going to get the tax cut can realize immediately that they're going to get it and start thinking about spending that money, okay, in productive ways, new investment projects, right away, whereas the spending stimulus inevitably had to take time. So, to summarize my view on the stimulus, I think it was badly designed from the perspectives of efficiency and from productivity. It was badly designed relative to the evidence. An enormous missed opportunity. It was an enormous missed opportunity because the administration could have made the structure of the economy better in a way which would have addressed the recession and been better for growth going forward over the long haul. So let me talk about a few other policies to suggest that this is a general tendency, the emphasis on dividing the pie over growing the pie. Okay? Other obvious example to discuss is Obamacare. Okay? Been clearly the preoccupation of the administration for about a year. What does Obamacare mean exactly? Roughly, it means a mandate that everyone has to buy insurance, point one. Point two, it means substantial subsidies for many of the people who are being mandated to buy insurance, because you can't mandate that someone with an income of $30,000 a year has to spend $15,000 or $20,000 a year of that on a health insurance premium. So, of course, there are going to be subsidies, okay, for people to be able to afford the health insurance. And then there's a lot of regulation of the health insurance industry geared toward making it possible for everyone to always get coverage at a relatively low premium. That is, restrictions on whether insurance companies could drop people from coverage, community rating, which means basically everybody pays the same premium, and bans on pre-existing condition clauses. So anyone, anytime, regardless of medical history, can get insurance and pays the same rate as everyone else. The claim the administration made for this is that this was going to be good for everyone. That not only were we going to cover another 30 to 40 million people with health insurance, okay, but we were going to create lower premiums for everybody who already has health insurance, and we weren't going to have to reduce the amount of health care obtained by anybody in the economy. Okay? Okay? Obviously, if you could pull that off, you should do it. Okay? That would be a great thing if anybody could do it. Okay? But it was utterly implausible on its face. Okay? You just have to think about how much it would cost to insure another 30 to 40 million people to realize that doing that while saving money, okay, is just, the arithmetic couldn't possibly add up. Okay? Now, the administration, of course, offered a bunch of reasons why they asserted that their program would, in fact, lead to increased coverage, lower cost for everyone, and no reduction in care. They talked about things like doing comparative effectiveness research, doing research on medical practices, deciding which ones are actually most effective, and trying to make every doctor use those rather than sometimes using relatively costly and ineffective procedures. Okay? They talked about trying to reduce emergency room use, getting people into regular insurance plans so we would save a lot of money from reduced use of emergency rooms. They talked about increasing competition through various forms of regulation. The problem is that none of their assertions about how they would save money, okay, is remotely plausible or consistent with the existing evidence. Okay? To give an example, the comparative effectiveness research certainly identifies instances where some hospitals are doing things in a high-cost way and others are doing them in a low-cost way. But when you look at the details, you see that there are reasons that it isn't trivial to just use the low-cost procedure on the high-cost patients. Many of the high-cost patients were high-cost for a reason. They were subtly different than the low-cost patients, and that's why the doctors used more expensive procedure. So of course, you could impose the low-cost procedure on everyone. That would save money, but it would save money by reducing care. It's not the claim that you couldn't reduce cost that was incorrect. It's a claim that you could do it, okay, without any sacrifice, okay, in the amount of care people provide. So the evidence for the claim, it was just not there. Okay? And so the claims are incredibly unpersuasive. Why did they make those claims? Because if the administration had gotten up and said, you know what, it's the just right thing to do for us to provide generous health insurance to everybody who doesn't have it, that probably would have been voted down in the Congress. It probably would not have commanded enough popular support. Okay, so instead, they dressed it up as being efficient, as being a win-win for everyone to sell it to the American public, but the evidence does not back that up. Just a few more quick examples. Another major initiative was housing. The administration's main objective there was to prevent foreclosures. Okay? Now that sounds like a compassionate goal, but it's not an efficient goal. It's in fact directly contrary to what good economics would suggest, because the vast majority of people at risk of foreclosure are very unlikely to ever be able to afford the houses that they're in, because other people might be able to afford those houses if they were resold at lower prices. And so the administration is not making the housing market more efficient, even though they made some assertions to that effect. They're simply redistributing resources to a group, sort of low middle income households, okay, who don't want to be forced out of their homes. Indeed, US housing policy long before President Obama has taken the same tack. It's insisted that everyone should get a house independent of the inability to pay. Okay? That's a redistribution. It's not anything that you can justify as being an efficient way to utilize society's resources. The auto bailout is another example. Okay? Now, economists disagree. Obviously, the populace generally disagrees a lot about the banking industry bailouts, the Wall Street bailouts. Whatever you think about the banking bailouts, okay, for them, against them, there was no case for the auto bailouts. There was no risk that having GM and Chrysler go through bankruptcy, standard bankruptcy, would have done anything particular to the rest of the economy, okay, and therefore there was no reason to intervene, okay, in those particular bankruptcies. Why did the administration do it? Because it engineered bankruptcy outcomes which gave a lot less money to creditors and a lot more money to the unions. In the standard way a bankruptcy would have proceeded, the creditors would have been higher in the pecking order as the claimants on the remaining value of those companies, okay, and they would have gotten more relative to labor, but in fact the administration intervened in a way that gave much more to labor, both through the settlement of the bankruptcy and through the bailouts that went directly to the auto companies. Again, there was no economic efficiency justification. Okay? It was just a way to redistribute to a favored interest group, the administration and Democrats in Congress in particular. One last example is cap and trade. Now, cap and trade seems to be dead in the water in Congress. It doesn't look as though it's actually going to get enacted, but it's still a useful illustration. What is cap and trade? It's a system where the government will decree that there's only a certain number of permits available for the whole country to be able to emit carbon dioxide. Okay? It's an attempt to reduce the burning of fossil fuel. The standard justifications are that this will help promote energy independence, that this will reduce our global warming, reduce pollution. Okay? Whatever you think about those claims, okay, I will certainly a global warming skeptic, but set that aside,